between diaphragmatic eventration from phrenic palsy from hernia. Now, what is diaphragmatic differentiation? Eventration. Eventration occurs basically, it is the elevation of the diaphragm which occurs because of absence of normal diaphragmatic tissue and its replacement by connective tissue, and that is why the diaphragm appears elevated. It generally, whereas phrenic nerve palsy is due to paralysis of the phrenic nerve, whereas hernia is due to the ascent of abdominal contents into the chest cavity. Now, eventration generally occurs on the, what are the differences? Eventration generally occurs on the left side, phrenic palsy occurs on the right side, and hernia also occurs on the right side. Eventration is never associated with basal atelectasis. That is always absent on eventration. It is present in phrenic nerve palsy and it is present in hernia. Also, eventration is there is a continuity in the diaphragmatic contour. In phrenic nerve palsy also there is a continuity, but in hernia we can see that there is a loss of continuity, or there is a discontinuity of the diaphragmatic contour. Also remember that paradoxical movement, that is movement of the diaphragm downwards on expiration and inwards on inspiration, is most marked in phrenic nerve palsy. However, it does occur in hernia and eventration also. So it is the side which matters, and it is the paradoxical movement, the basal atelectasis, and the continuity of the diaphragm which helps us to differentiate all these three different pathologies of diaphragm.